Welcome to CMM Off the Page, a podcast brought to you by CMM Magazine, a brand of Care Choices Limited. Guest speakers will equip listeners with take-home advice to support best practice in the social care sector. The podcast is available to listen to on Spotify, Apple Podcasts, and to watch on the CMM website. We hope you enjoy this latest episode.
OneTouch is an award-winning care management system which allows care providers to manage every aspect of their clients' needs. Information is shared simply, instantly and securely across all key stakeholders involved in an individual's care delivery circle. OneTouch digitizes your processes to save time for you and your team. The system is built by people who have worked in care settings, which means that it can work exactly how you need it to across every function of your care organisation. To find out more, go to www.onetouchhealth.net and book a demo today.
Before we get started with the latest episode of CMM Off the Page, we would like to acknowledge that this podcast was originally recorded in the summer of 2023. This means that some of the factual content discussed by our guests in this episode has been subject to change since the date of the recording. We are committed to providing accurate and timely information to our listeners, so if you have any questions about the content of this episode, please email editor@caremanagementmatters.co.uk.
Hello and welcome to CMM Off the Page podcast. Today we'll be sharing the latest challenges affecting the home care sector and discussing what the impact has been on the well-being of the home care workforce. The Homecare Association's new Care Provision and Workforce Survey 2023 has demonstrated the challenges facing health and social care. Over half of providers reported that they are delivering less care than this time last year. And this is despite almost 3/4, 74% of providers stating that the demand for home care has increased since the beginning of 2022. This must be having a detrimental impact on teams across the UK. And here to share those findings in more detail is Dr Jane Townson OBE. And Jane is the Chief Executive of the Homecare Association, the UK's membership body for home care providers. Welcome, Jane, and thank you for joining us. We are also joined by Sharon Lowrie. Sharon is the Chief Executive of Be Caring, which is the UK's largest employee-owned provider of social care. Be Caring delivers home care services in the north of England, and Be Caring is also a social enterprise, meaning that it's committed to making a lasting difference to its communities. In December 2022, Be Caring celebrated its highest ever colleague advocacy score, with 87% of colleagues recommending them as a place of work. And some very impressive results. Sharon, and I look forward to hearing about Be Caring's values and your initiatives to support the workforce to make sure that they feel valued and recognised. Welcome, Sharon. And finally, we are also joined today by David Glover. David is the Chief Executive of Caremark. Caremark is one of the largest home care organisations in the UK, delivering more than 110,000 hours of care every week. Caremark serves private customers and who pay for their own care, as well as customers who require their local authority to arrange the care. Caremark also has a franchise support centre to help other providers grow their business, so operating it on a franchise basis. So welcome, David. I look forward to hearing your insights today, and thank you for joining us.
Oh, totally, thanks for having me today.
Great, thanks, David. So yeah, I obviously mentioned briefly in my intro there, Jane, about the latest sort of findings within the challenges and within that workforce data. So I wondered if you might want to begin just to give us that broader overview at the moment of those challenges.
So demand for home care has been rising for some time, and that's very positive because many people want to be supported to live well at home and to flourish in their communities, and we can make a huge difference to many people's lives by supporting them in that way. But there are challenges recruiting enough care workers to meet the demand. So the vacancy rate in home care, as reported by Skills for Care monthly tracking, currently stands at 13%. That compares with a national average across all labour markets of about 3%. So we are over 4 times the national average, and even compared with other parts of social care. So the vacancy rate average overall for social care is 9.9%. So we are still down even on that. Now, if you look at workforce numbers over the last 10 years in home care, they've actually grown steadily, and still are higher than the number of workers in care homes. But sort of around about 2020, 2021, we saw quite a steep fall off of numbers, both in home care and care homes. We can speculate the reasons for that. Probably a combination of factors, Brexit, COVID, and a tight labour market. The numbers have recovered a bit. I mean, members have been reporting in May better recruitment and stronger growth of hours delivered. But talking to CQC Market Oversight, who review the largest providers in both care homes and home care across the country and specialist provision, in home care, the larger providers are reporting collectively a 15% reduction in the hours delivered. And that is mainly related to inability to hire enough people to meet the demand. I think we are quite concerned also that some of the smaller providers have been experiencing that too. And there are complicated factors involved. So local authorities, some of them, and Sharon and David will explain this in more detail from being on the ground with it, but some local authorities have procurement portals. So every new person that needs care is sort of put on these portals as a package, and then providers can bid for them. And when there was all of the panic about hospital discharge a few months ago, some local authorities opened up their portals to double the number of providers that were on there before. And that means that the hours that were available got spread over a much larger number, which then means that for each individual care worker in an individual organisation, there are fewer hours available for them to pick up. And of course, they need enough hours to generate enough income to live. And so if they don't get enough hours, they leave. So some of these sort of market factors and how the market is shaped are influencing recruitment and retention beyond just pure pay rate. So I'll just pause there.
Yeah, no, thank you, Jane. That's really interesting. Good to have those insights as well. Obviously, that change in May. Obviously, there's been almost not all negative in a way that is, slowly there are some positives coming through, which is really good to hear. I'm not sure, Sharon or David, if you wanted to sort of be interested in your, I suppose, as Jane mentioned, sort of on the ground, but what's the reality, I suppose?
Shall I go first, David? Yeah. So I think Jane's absolutely right. I think that coming into home care 5 years ago for me, I was slightly horrified really about how we value and treat the care workforce, the consistency of income. They can start on a Monday morning and think they've got 40 hours work, and then by sort of Monday evening, it could be half due to many factors. So I think that's one thing we've got to do. We've got to value the workforce. We've got to give them guaranteed hours, but we've got to empower them. We've got to utilise their time. There's so much opportunity for them to make a difference in the communities. So we've got to unlock this somehow. So I think that's been our biggest focus in the past few years, is that regular shift work, guaranteed pay, trying to introduce sort of progressive paying, better pay for length of service, etc., which is really hard when the local authorities are sort of dumbing down the hourly rate. But yeah, I totally agree. We work in, as one local authority, they've got 100 providers. And if you spread that out across, spread all those hours out, it doesn't give each provider enough volume to value the workforce. But I think when you're looking at the well-being of care workers, it doesn't give you enough backup office resource. These care workers are out on their own, working long days, minimal contact with the support. So that investment in your back office infrastructure is absolutely crucial. So yeah, I could talk about this all day. So
that was actually something I was going to, and obviously, and I'll be interested in David, obviously being in the large organisation, how do you manage those regular check-ins? How do you ensure that that staff can have the space to feedback and how they're feeling, and how do you monitor that when they may be, obviously there's not the time, is there? So I was interested in how you manage that, and probably advice for other providers to make sure that staff are okay. David, did you want to comment on that?
Just taking a step back, actually, and looking at what Jane said earlier, we as an organisation have just come off first quarter where we've had record growth. So we are seeing, there's a record turnover within the network. But what is interesting is that our hours of care are fairly stagnant. What is happening in our company is that as an organisation, we are quite unique within the franchised home care sector, in terms of our model is very much providing local authority care as well as private care. And that's part of our key values. And we always want to provide care to everybody. We don't want to provide care just to people that can afford it. We want to provide care to everybody. And we think everybody should have that right, that high quality of care, irrespective of social standing. But our franchisees are moving away from doing local authority work and moving to more private work with higher margins, better rates of pay. That's why you're seeing that our turnover as a network is increasing, but our hours are stagnant. But we're also seeing, as Jane said, increased capacity within the network. For the first time, and as long as I can remember, I've got franchisees that are saying that they have capacity and they've got care workers that have the ability to take on more hours. And as Jane again rightly said, what is happening is those care workers are now thinking, I need those hours. I need those hours to put food on the table, to pay the mortgage, and they are leaving the industry now because they haven't got those hours. But going back to your point is, I think it's really important to have those regular touch points with carers, to make sure that they're valued, to understand what's going on the ground. And that's something that we do on a regular basis through a variety of means. So one of the things that we've introduced as an organisation over the last 6 months is a employee engagement app called Connect Team. And that is something that we've mandated for all our franchisees. So we trialled it first in 2 or 3 offices, and we've now rolled it out across the network. And this is an app that replaces WhatsApp, that all our carers now communicate through the app, but it does so much more than that. Our carers are lone workers. It's a very lonely, sometimes soul-destroying existence. And having that ability to communicate with fellow care workers, to communicate back with the head office, make them feel part of a team, make them feel valued is so important. And also the app contains all their training on it. It contains the ability for them to request holiday easily. So we're finding that the use of an employee and carer engagement app has worked tremendously well. And we're seeing that have a significant benefit on retention of staff and recruitment of care workers.
Brilliant. Yeah, David. And how much, you said that there's sort of care workers are then sort of communicating with people back in office. Is that something that is, quite time heavy, would you say? I'm just thinking about smaller providers and if they wanted to explore that.
I would thoroughly recommend an employee engagement app to any care company, irrespective of size. It does free up time in the back office, but it just makes life so much easier. The app that we use is available, I believe, for small companies, irrespective of size of workforce. Because, if you look at our franchise network, we have 120 offices, and they vary in size. Some of our offices deliver sort of 300, 400, 500 hours of care a week, going up to our top offices, which are delivering nearly 10,000 hours of care a week. So all our offices, irrespective of size, are using that app. So yeah, in answer to your question, Olivia, any care company can use it, and I would strongly recommend they look at doing something like that to improve engagement with their care staff.
Olivia, just to say that although Caremark is a large organisation, because it's a franchise organisation, each individual branch mostly is its own independent business.
Yeah, sure.
So it's like having a network of lots of small organisations. So you still keep that sort of small, local, personal feel whilst having the benefits of being in a larger structure.
Yeah, sure. Yeah. That's good. And Sharon, obviously you be caring. You mentioned a lot about your values as an organisation, and also how staff obviously stay with you for such a long time. Why do you think that is? What do you think your key to success is?
I think we've learnt the hard way. So I think we've had a tough few years, and I think it's the last couple of years we're starting to feel that benefit of I think we really support new carers at the start of their employment with us. So the interventions that we and the support we give carers at the beginning of their employment is far more resource intensive, because we'd rather put that energy in at the beginning to hopefully keep them. We do have regular sort of check-ins with carers. It's all systematically monitored, and nobody can fall through the net. We have regular, we call them sort of coffee and cake sessions. So 2-3 times a year, so we invite them in. We have a full day. It really is a day of celebration. So bizarrely, they're happening this week. So we're this week and next week, and we've got long service awards. We've got above and beyond awards, and this is an opportunity for carers to nominate other carers, or the back office to not, people, carers do amazing things every day, and they just think it's normal. Do you know what I mean? But actually, they're making such a huge difference. So we really want to celebrate that as well. We give them £25 gift voucher on their birthday. There's a Christmas bonus, which has been £250 every year for the past few years, which is tax-free. So it's a bit like the John Lewis model. And I know not everybody can afford that. So we definitely taken the approach about, so that there's some fundamentals about the structure of an office. It's got to have that volume to be able to value your workforce, and that density in a local area to create your efficient runs. We've got to be able to invest in a back office infrastructure to give us that strength in depth. I don't want anybody working 24 hours, 7 days a week. It's not fair. So there's the mental health and well-being of your care workers, but there's also the back office infrastructure, and we've got to look after them. We really do. So I think we're trying to do this at the right size to tick all the boxes, really. It's not easy, is it? We've got a hardship fund where we do try and support carers, but that when they run into a bit of difficulty. So it's trying to be as responsive as we can to the needs of the care workforce. And the biggest thing I would say is regular hours, regular working pattern, paid for the full time they're out at work. None of this fluctuating in hours because unfortunately a client's gone into hospital. So we've started off with the very, very basics, proper pay, and good mileage rate. So let's try and treat the care workers like any other employee in any other sector would expect to be treated. We've got to get the basics right.
Sharon, I think it'd be good if you said a few words about how you've been trying to persuade local authority commissioners to purchase the home care differently to enable you to do some of these things.
Yeah, so we tested out a model. We started this about 4 years ago, and it's so we pay the carers from start to finish. I'm not going to say in shifts because that's not. I think that's misrepresenting it really. It's when they start to when they finish, and it's our then job to make sure that there is sufficient work within those rotas. Now there are sometimes gaps, but what we then do is we encourage carers to pick up the phone to say, right, what difference can I make? I've got a gap, I'm out working, I want to be, if they choose to take it as an unpaid break, that's entirely their decision. So to allow us to do that, we've obviously negotiated the payments for the hospital clients, but we're moving away from you can't give us 24 hours notice and cancel it and the hours reduced. We've also we have a little bit of flexibility within a couple of local authorities have allowed us where the rates are low. So we work in the north of England, the rates are the lowest in the country. So in essence, what the commissioners think they're buying and what they're, what is actually achievable within that amount of money is the two don't marry up. So where we've had a 30-minute commission call, And we've supported this client for a long time. And then, you know, it's showing that it's a 20 minutes call is sufficient. Some commissioners have allowed us to plan in a 25-minute call to give us that leeway for the travel time. And we're still in early days with some of this thinking, and we really need to think through how this can be commissioned, how we can create this open, transparent way of working, proactively work with social workers, and take away this them wanting to beat us with a stick, really. So it's what we've tried to do is negotiate a few different levers to give the provider, give us more leverage in how we can support the workforce. This whole task and time, it's 30 minutes, it's 45 minutes, it's 15 minutes. It takes away it makes it totally inflexible. So that's the bit that's really unlocked as how we advertise, how the conversations we have with carers. We're recruiting better quality carers, they're staying with us. And I think now we've got this model where we potentially can take it to other local authorities and offer something slightly different based on trust, transparency, openness, open book accounting. You know, we've got nothing to hide because it is so challenging when the rates are so low. Does that make sense?
Yeah, thanks Sharon for those insights. That's really interesting. And Jane, obviously the Homecare Association has outlined a number of calls on government recently. Firstly, how confident are you that they will be fulfilled? And when we think about the NHS 10-year workforce strategy, what do you think that should look like for social care?
First of all, we've called on the government, we've been doing this for a long time, to invest adequately in home care so that we can maintain and grow the workforce and recognise and reward them fairly for the skills, competencies and the work that they do. We've also called for a 10-year workforce plan for social care to go alongside the NHS one. But really, we need to look at both workforces together. So if you think about what Sharon just said, if care workers have got gaps in the rota, because often you get a peak, you know, first thing in the morning and then it goes down, then up. But there are loads of potential healthcare tasks that can be done in the community. The NHS workforce is stretched. So why not view them as multidisciplinary teams in a geographic area, working together to support people. So, you know, some people, some home care workers in some places are doing things like remote health monitoring. And during the pandemic, we saw substantial delegation of healthcare tasks from district nurses to home care workers. I might add, without any additional remuneration, but the chief nurse, Deborah Sturdy, has done a considerable amount of work together with Skills for Care on delegated healthcare tasks, as an example. And some local authority commissioners are beginning to explore the potential for commissioning that in a slightly different way, you know, to give a premium to providers that take on those kind of roles. But I think that, you know, care workers are no different from the rest of us. All of us want autonomy, a sense of belonging, a sense of contribution, being able to make a contribution. And sometimes I think that the way that the state-funded work is commissioned is quite restrictive. Like Sharon said, you know, you will go there for 15 minutes or 30 minutes, you will do this, that and the other. In the private pay part of the market, and David can speak to this, you know, that the person drawing on services is the commissioner. If they say they want more time or less time, or they want to do this or they want to do that, wherever possible, that's accommodated, and that flexibility is there, and the care workers can make quite a lot of decisions themselves, and you know, they are the best placed people to do it. They're in people's houses every day, they know what's happening, you know. And that sense of belonging can be challenging due to the remote dispersed nature of the workforce. But as Sharon said, if you've got adequate supervision and also apps like the one that David's talked about, that helps. But the supervision itself is a challenge in the local authority world, because on average, there is about one supervisor to 25 care workers, because that's all everybody can afford. In any other business, you would think that that was ridiculous. Who can directly supervise 25 people and do it properly? And some providers have gone for, I think Sharon's ratio is you know, much better than that. but she's received challenge from commissioners about why are you spending all of that money on supervisors? You know, other people are doing it more efficiently, but it's a false economy to skimp on that sort of stuff, you know. And it's also, if you think about the work that they do, quite often they'll walk in and they'll find quite a challenging situation. You know, somebody might have died, or there could be a domestic thing going on, and it's having that ability to debrief and support people. And in my previous role, we had, when I was a care provider CEO, we had some teams that we provided services for people with learning disabilities and physical disabilities, and some of them we had supported for over 20 years. And when one of the people that they were supporting died, they felt it like it was a member of their own family, you know. And I remember sort of giving an award to one team, and they all came up to the front, and they literally, none of them could speak. They were just all in tears, and that is how it is, you know. So that kind of care, you know, the government's, the fundamental problem with the workforce policies that we've got is that they're not addressing the elephant in the room, which is the enough investment to be able to do all of these things properly. Yes, you can come up with career workforce pathways, and that's great, but if you haven't got any money, enough money to be able to pay people more money if they get promoted and do more qualifications, or like Sharon said, if they've got, you know, more years of experience. And I think it's quite important to recognise too that there are really substantial numbers of people in home care that have been working in it for absolutely years. There is high turnover, but it tends to be mostly at the beginning when people come in and they realise it's not for them.
They don't know what the job's like.
Yeah, in my previous role, I gave out 2 50-year service awards, 50.
Wow.
One of them was to a lady called Eileen, who at the time was 84. And she was still going out on her bike every day, delivering home care to the people in Bridgewater, the old people, she told me. most of the people she supported were younger than her. I think everybody will have those kinds of people in their organisations, you know, and that they stay because they love the work. They love that sense of improving lives. They get a reward from that, an emotional reward that you don't find if you're working on the till in a supermarket.
Yeah. You know? Do you think, Jane, like talking about, like thinking about, you know, is it Eileen? Do you say Eileen? Yeah. Do you think that's something that, you know, she was obviously able to manage those, you know, those stressful work days, that maybe, you know, the trauma? Do you think that, you know, that is an individual choice to go and work into that sector, or, you know, is it just obviously there needs to be more support? I mean, I'm just thinking about her long years of service. You know, did she have that amazing support in her organisation, or do you think it is like a personal, individual ability to sort of manage those?
I'm sure it's a bit of both. And you know, when she first started, because we dug out her, she's died now sadly, but when she first started, we dug out her you know, her sort of job application, and it was all about you know, she had to light fires and support nursing mothers, this kind of thing. Like, you just can't even imagine that happening now, because people nowadays are only eligible for state-funded home care quite close to the end of their lives. I was talking to one of our members earlier this week, and he was saying that, you know, a number of years ago, the sort of average time that somebody would be in a home care service in his organisation was 3.7 years, and now it's something like 17 months. Wow. That is a reflection of the fact that local councils have had to ration the money that they've got, and they're waiting until, you know, the last possible moment before commissioning care. So sort of almost by definition, particularly in the state-funded part of the market, you know, the needs are very high. Most people have got healthcare needs that are quite complex, dementias, frailty, and so on. But I would say probably David will comment on this, that even in the private pay part of the market, we're seeing that too, you know, the complexity of need increasing.
Yes, we are. Absolutely, Jane. We're seeing the complexity of increasing, which is putting greater strain on the workforce. And you are seeing people leave because of that. And also just picking up on your other point about doing more tasks, having more joined up thinking. I think one of the major problems we face as an industry is the perception of workers within the industry, that it's unskilled, that people do it because there's no other job available to do. And that's completely wrong. You know, the care workers that we have, and I know Sharon will have, and every other organisation has, you know, they're fantastic. The job they do is incredible. and yet people regard it as unskilled. I think I read a story the other day where there was in a school where a school teacher said to a child that wasn't performing, that wasn't doing their homework, was messing around in class, and they said, "What do you want to do when you're older? Because if you carry on like this, you'll just end up being a carer." And that to me is just outrageous. And that is the perception. And I think that as an industry, first and foremost, we need to change that perception of what the job is and to educate people. As an organization here, what we do is, we're in the franchise support center here, so we support the network, but we also have a company-owned office, which enables us to keep in touch with what's going on the ground. And we require all our staff here at the franchise support center to go out and shadow our care staff. And I can tell you, when I did that, that was one of the most humbling experiences that I've ever had as an individual, to go and see the difference that they make firsthand. And I just wish everybody had that opportunity to go and see the work that carers do.
Definitely relies on goodwill. And I think that's why the governments have got away with it for so long. These people care massively, and a lot of people who do leave they love their job, but because they haven't got that regular income, they've got children, they've got caring duties themselves, they can't live off the terms and conditions that providers can give them. It really is unfair. So that's got to shift. As an employee-owned organisation, we want the very best for our care workers. We're all equal in the organisation, and almost because we don't have the eyes and ears, and we're not with the carers throughout their working day, the partnership with union just gives us another somebody else for them to go to if we're not getting it quite right. So we want to get it right. We want to know if we're getting it wrong, and the trade unions can support in terms of some of the negotiations as well, and advocating with commissioners and councillors about the value of social care. So I would say to providers, don't necessarily be as scared of the unions as I think there's an opportunity.
I just wanted to pick up on a point that Jane was talking about a moment ago about having, if a home care worker has had a particularly challenging visit, and then and then is straight on to a next visit, how do providers currently sort of manage that? I suppose, is it a case of you can't, it's a sort of off you go? I'm just interested to hear how that can be done, because obviously they might not be able to go onto a next visit, but then who's going to cover that next shift? Is it just a case of have a chat at the end of the day, or do you see what I mean?
So I think that's where, if you paying carers properly, paying them fairly, paying them in shifts, they are. A lot of times when I first started, you'd have carers would spend so much longer in a visit because they were waiting for an ambulance, and for some reason, it was wrong, they just didn't get paid for it. So what you want to take away this financial element of it. You want them to pick up the phone, be able to have a conversation with the office and say, right, what's the best thing to do here? Actually, I feel as if I need to stay, and then the office can source an alternative carer for their next calls, or maybe go and cover it themselves. But we've got to really listen to the care worker.
Olivia, I don't know, I can't speak for other organisations, but what used to happen in the one that I was in previously was that we had some staff that were available to cover at short notice, because things always happen.
Yeah.
If somebody could fall off their bike or and if somebody, for example, we had a care worker who in her first 3 weeks of starting ended up having to perform CPR on a person and managed to save their life. But obviously that was quite a traumatic experience for her. So she didn't have to carry on that round, and other people just went in and took over. So I think that's often what happens.
Yeah, sure. Yeah, I think it's just interesting with that, obviously the amount of care that needs to be delivered, and the shortages and stuff, and I suppose just at this current time how that's being.
I think you're right though, Olivia. I think when you've got a day where you've already had a number of people go off sick that morning and your contingencies have already been utilised, that's when the pressure is on, isn't it? yeah, it's not easy.
Yeah, I suppose that's probably that kind of comes back, Sharon, to having that good open culture, so care
Definitely.
workers can then feel that they can, rather than I think what a lot of care workers do is it's just I need to just carry on, it's just part of my job, and it is being able to actually say no.
I
and then be
think
able
I think what isn't recognised often is that home care workers often hold a great deal of responsibility for somebody's welfare. So, for example, I was told a story by one of our members a while back where there'd been somebody discharged from hospital. So it was the first time this provider had supported this individual. And when they arrived at the house, they found that the house had flooded while the person had been in hospital, and it basically wasn't safe to live in. You know, there was like exposed wires and water and plaster everywhere. So obviously they phoned back to the office, who then phoned social services, you know, social workers, and literally it took over 12 hours before anybody actually did anything. And this care worker wasn't willing to leave this person on their own because they didn't think it was safe, you know. And so all of that responsibility, you know, that there were other people, other professionals within the system passing the buck is what it seemed to me. But the home care agency, because they've got the CQC registration, etc., you know, they have to be the ones that sort it out. And I just think sometimes those sort of issues and that level of responsibility isn't properly recognised.
Definitely not. Definitely.
Yeah,
We've had a number of sorry, David, go on.
Oh, no, I was just going to say, so, you know, it is tough being a care worker. There are situations which no person should really have to face, you know, where they turn up at clients' homes and find that the client's unfortunately passed away and having to deal with that. So what we do is, some of our offices, our larger offices, have now taken on wellbeing officers, so that is a go-to person for a carer who has had a tough day, that they can speak to that person. That is a specialist person can offer that support, that emotional support, and also signpost them to other organisations where to go and get help. We also have a counselling line that all carers have access to, so that is available 24/7 to people. I think us and a lot of other organisations now recognise that mental health is so important, and that it's not a stigma. It's something that we should support our care workers on, and we're very active in doing that. And I think that not only does it help the carers, but it also, from a selfish point of view, encourages retention of staff, better productivity. So it's a win-win situation. And I think more organisations need to understand about the support you need to offer your staff over and above just asking them to go out there and do daily care calls.
Yeah, definitely. And would you say that you've seen an increase in those access to those services, David, sort of this year? Or
Yeah, I mean,
particularly?
some of the stories I hear are just heartbreaking. You know, where you hear about carers that have been driven to such an extent where they're having suicidal thoughts, and the ability to be able to go and speak to somebody, and whereby, you know, in turn we've supported that individual to overcome the challenges that they have at that immediate time, and you know, that's so important for us to be able to do that, and for all care staff to feel supported and valued.
I'd like to
Absolutely.
give a bit of a shout out for the Care Workers Charity here, because they have funds that can be used to support care workers suffering from difficulties. Now, honestly, in an ideal world, we wouldn't need a Care Workers Charity. You know, my measure of success is when we don't need that anymore.
Yeah, that was actually Carolina's quote, Jane. I asked her actually what would success look like for her, and she said that the charity wouldn't exist anymore. So yeah.
Some of the government's proposals, which they've now canned for wellbeing, were what I would see more as sticking plasters. You know, that you can look at different levels of intervention: primary, secondary, and tertiary. So primary interventions are sort of stopping people having, you know, wellbeing issues in the first place. So that could be making sure they've got enough pay to live on, because, you know, there's no point sending someone to a financial counsellor because they're not earning enough money. You know, you just need to pay them enough money and set up the system that does that fairly. You know, then secondary interventions could be, you know, helping people cope with the difficulties of the role, because there is a certain amount of resilience required, but I get a bit cross with overuse of this word resilient, because it's almost as though workers both in the NHS and care are sort of being blamed for, you know, for not being resilient enough, when in actual fact the problem is a work environment that isn't reasonable, you know. And then, you know, thirdly, it's sort of, you know, the tertiary interventions are sort of picking up the pieces after things have gone wrong. And where I would like to see us focusing as a sector is in the former. You know, let's try and create an environment that makes it feasible, and as you know, people shouldn't be having to worry about the basic necessities of food and whether they can clothe their family and whether they've got a roof over their head. And we there are some issues in relation to the benefit system and the interface with home care here, because of the uncertainty of the hours. Nobody can risk losing their benefits, because obviously housing is a big proportion of our income for all of us and the costs of it. And so that also creates a bit of a barrier, because it's very sort of, everybody understands that you can't work full time and take benefits, but when your work is very uncertain and those terms are dictated by the state, you can't then risk doing more hours than you would, you know, to affect your benefits. So I think, I don't know what Sharon and David think, but I feel it more thought needs to be given to how those sort of interfaces with the benefit system work. If we were able, all of us, to do more of what Sharon's been able to do in some places, which is give more security of income to care workers, that would help to deal with that issue.
I couldn't agree more, Jane. I think I've always said, if I had a spare couple of weeks, I really would like to delve in and really understand the benefit system, because the a number of carers, I can't work any more hours, or if we give them a bonus, then there's an impact on their benefits, and it's not driving the right behaviour across everywhere. So I think that would be a very big plea, just to align it all to drive the right behaviours, to reward and value people. But I totally agree. It drives me slightly mad when I hear there's a recruitment problem. There isn't a recruitment problem. You know, we can recruit people. The question is, can we keep them? And you know, we're trying our very best, but we are losing a lot of good skilled workers who love their job, who just simply don't feel valued, and that's the bit that we've got to get right. Certainly, I wouldn't say there was a recruitment challenge. It's absolutely a retention challenge, and that's where the focus has got to be.
Brilliant. Thanks. Sorry,
one of our difficulties politically is that, sweeping generalisation alert, but politicians tend not to do things ahead of public opinion if they can avoid it. And with the NHS, for example, that's very well known and understood. It's not as well understood as people think, but people, you know, general, and I think at least 88% of people have been to see a GP in, you know, the last year or something. So people have a lot more contact, whereas the number of people that come into contact with social care as a percentage is much lower. And by the time people get to that point, quite often they're so exhausted from just trying to fight their way through the system that they don't necessarily write letters to their MPs and so on. I mean, I do think things are beginning to change as MPs, members of the House of Lords themselves are experiencing the system as they're getting older themselves or have got older relatives, and they realise and they can see firsthand what's happening. So things, you know, are shifting a bit, but still not enough. You know, politicians know that they can get away with it. You can see now the Secretary of State is focusing on elective recovery, you know, getting the waiting list down on hospital discharge. The fact that social care is intimately involved in all of that is being kind of conveniently swept under the carpet.
So I was a finance director in the NHS, and we were given significant contracts. We were given guaranteed income. We could commit to a certain workforce. We could give salaries. We could give contracts. In home care, it's absolutely the opposite. You're not actually guaranteed anything. which makes it impossible to value the workforce. And even a client can go into hospital the next day, they can pass away, that money just stops. So the gulf between the NHS and social care is huge. You look at pension contributions. The NHS have got a final salary pension scheme. The government will contribute, I don't know, it must be about 15-16%. When you look at the auto enrolment, the calculations for the price of home care, that's probably what, 3% now, is it? So that we've got to look at that. There's got to be a change. We've got to make them more aligned. It's almost an impossible ask of what is being asked by providers to deliver, I'm afraid.
Yeah, absolutely. Yeah, certainly. Just in terms of the team element, I know obviously, because David obviously mentioned the app and everything, and I just wondered about that kind of bringing people together, just in terms of that, for that well-being, and different things that you do, Sharon, in terms of, either physically or virtually, I suppose, in terms of that connection within the team.
Yeah, this week is a perfect example. I talked about it earlier, but we invite all the carers into the office. We've got a couple of days in Newcastle, a day in each of the other services. We have an employee group called Voice, and they're actually coming. They're going to be there to listen to care workers. They're going to be giving out the long service awards. We do sort of annual surveys, and we get feedback on what's going to make a difference. So just before Christmas, we handed out a lot of safety equipment, sort of rain max. So it was almost you said we did type of thing.
Okay, yeah.
So it really is constant two-way communication, and actually being honest when you can't do something. Do you know what I mean? It's but yeah, it's I think really our values of be kind, be caring, be involved, be safe. We do try and it's very simple language that everybody understands, and we do try and live by those values. And our be supported sessions, we don't call them supervision, because I find that quite old-fashioned really, but be supported. So it's all of this, try and bring the values out in the conversation with the carers. It's not an overnight fix, absolutely not. It's about embedding those values in what you do every day, and having that open culture across the entire organisation where people feel they can raise issues, be listened to, and it'll be acted upon.
Brilliant. Thanks so much, Sharon. Yeah, that's really, really good to have those points. And David, if you had a couple of sort of, take home, if you had a piece of advice for providers listening on, if they can go away after listening today, what would you say would be something that you think they should definitely go and implement, or to go and explore further to support the workforce?
I think it goes back to supporting mental health and well-being, making sure that carers are okay, going that extra mile for them, making them feel valued. I think that as an industry, actually, we can also help ourselves more. I think that we should be doing more to raise the perception of home care. We should be helping ourselves. It's one of my bugbears, to be honest with you. When I switch on TV, national TV, and see, care providers on the sofa there on breakfast TV talking about, how low the rates of pay are for care, that all these companies are operating illegally, and yet they're paying their carers £15-16 an hour. That's great for them, but what that does is create a negative image of the industry as a whole. And I just wish the care industry would come together more and work together more, and take less of a parochial interest in their own businesses and look at the greater good, because virtually all care companies are not paying illegally. They're paying minimum wage, and we would all pay more if we could. But those sort of stories coming out there don't help us as an industry. And I think that unfortunately the media always want to focus on the negative stories. We need to try and get the positive stories out there, because there's so much positivity going on within the industry. So I think it's a question of trying to help ourselves as an industry and not focusing always on the negatives. I think it's about valuing your staff, making sure that you put in place the necessary support for them, not overburdening them, not overworking them, making them treating them as individuals, and realizing what an incredible job they do, and how important they are, what a difference they make to people's lives. So I would also encourage anybody that's sitting in my position, in a management position, to go out there and actually work alongside a carer, and go out there and see what they do day in, day out.
Brilliant. Thanks, David. Yeah, no, that's really, really good advice. Yeah, and I'm sure providers listening will definitely go and implement that.
Can I just follow that as well? And
yeah.
Whenever we start campaigning and pressurising councils or NHS bodies about fee rates for home care, for example, some of them turn around and say, well, providers are still working for us, it's a market. I know from experience that it takes a fair bit of courage to stand up and say, I'm not going to do this. And I know that people sometimes feel, like David said, that they had concerns about wanting to support everybody regardless of ability to pay. And I felt that very strongly too, because the organisation that I was in previously was a social enterprise. But at the end of the day, I came to the conclusion that I wasn't actually helping anybody by agreeing to work at fee rates below those that are needed to reward the workforce properly. And the only way that we'll get change is by voting with our feet. So we do give advice to providers, not to bid for contracts that aren't financially sustainable. And don't be afraid to challenge, because if the local authority can't find anyone to work at a particular rate, they'll have no choice but to put up the rate. That's how it works.
Yeah, and it's only when obviously that happens in numbers and more providers start sort of, pushing back.
We're kind of hoping that somehow, maybe over the longer term, the CQC oversight of local authority commissioning will flush out some of these issues, because right now it's the providers themselves that have the ratings, and in some local authority areas, that the number of providers that have managed to, only say 30% have managed to achieve a good or outstanding rating. Now that can't be a coincidence. It's because the fee rates are so low that it's very difficult to keep continuity of care and decent services going. And I think that some of those systemic issues need to be addressed. It's not just about individual employers. It's about creating the wider conditions in the market that enable individual employers to do the right thing, which most of them want to do, by the way. Nobody enjoys, as an employer, having to keep recruiting and people that have left. Nobody enjoys that. They really don't. I personally didn't. I would much rather not have had 0-hour contracts. Some people like to give the impression that that's employers' choice. No, because you don't really have very much control over workers. You can't guarantee your services either. That's no good for the people drawing on services. So the whole thing is one big well-being issue that we need to resolve at a system level.
Definitely,
If we could, so I've just a couple of pilot projects we've had where we are saying to carers, like, look, don't worry about the hours on your rota. You're going to start at 7 in the morning, you finish, around lunchtime. If you've got a gap on your rota, have a think about what value you can be adding in the communities that you're working in. And we've had some, really amazing examples from carers who I never thought would really engage with it that way. We've had one carer decided to, I think the person they were supporting, they were unhappy with the way, the layout of their room. And so it's just a bit of a clean up, a bit, moving things about just to create a better environment. We had last week, a problem with medication. So rather than waiting on a family member to do it, actually, they went down to the chemist, they sorted it out, they came back. So their immediate instinct was, actually, if I don't get this sorted, it could have a real impact further down the line if nobody does it. So it's about giving them the time, the tools, the space to think, right, what's going to make a difference? And that is my plea to, I think, any commissioner, is create an environment which empowers the care workers, where they feel valued, because we will reap the benefits further down the line. Hospital admissions, mental health. So we're not talking about the mental health of the workforce here. It's the people we're actually supporting, because they've got the time to really make a difference. So yeah, there's a huge opportunity with the workforce that we have. if we take away the perverse incentive that the current commissioning, drives. It just drives the wrong behaviour at all levels. So at commissioner level, provider level, carer level, it fundamentally, this task and time approach is broken.
And it is very important to make clear that it's not the commissioners themselves either that really want to do this. They've been forced into it by central government cutting their grant over many years. And yes, some of them can raise council tax, but there's a limit to how much that can add, particularly in areas where property wealth is not particularly high. So, this is why we, as a nation, we need to have a conversation about how we feel we should all be supported when we can't look after ourselves, and be willing to contribute to the greater good.
Yeah, so much wider public consultation then, Jane. I think, yeah.
I also, and Jane's mentioned it earlier, I see it all the time, we talk about government policy as just being a sticking plaster. Whether we look at what you're talking about earlier, Jane, or the hospital discharge fund that they introduced, it's all great for government, these headline figures of the amount of money that's coming in, but nobody's looking at it or taking that medium to long-term view. And that's what needs to happen more than anything. Somebody needs to take that long-term view as to how to have an integrated social healthcare system here in the UK.
Yeah,
well, we can't cope with the numbers of people over 85 that we've got now, and by the time I get there are going to be twice as many. So we really need to do something, otherwise it sounds a bit dramatic, but there could be complete breakdown in society if we have all of these people that are neglected in the community. What's going to happen? So collectively we've got to put pressure on our politicians. That's what will make the change. So encourage everybody to write to their MPs to demand better attention to this area.
And I think that's what slightly baffles me. We've got an ageing population. We've got a workforce that's reducing. We need to be maximising every single minute of every working hour of our care workforce. We do exactly the opposite. We pay them half an hour here, half an hour there, and then we expect them to take an unpaid break between, say, 10 and midday. And that time is really valuable, and actually is very, very cost effective compared to any other sector. So let's unlock that potential out there in the care workforce, is my plea, because I genuinely don't think it's going to be so cost effective, and then the impact, the savings on the NHS and hospitals and wellbeing and social isolation, it's going to be huge. So that's my plea. Let's unlock the potential in the existing workforce and really value them, because it's going to make such a difference if we do.
Certainly, Sharon. Yeah, I think that's like changing the attitude as well, isn't it? To really focus on who you've got and retain that talent. So we have more Eileens as well in the future, which I think is so key. Jane, I just wanted finally, because I'm conscious of time, if there was any sort of signposting that you'd like to share now with the Homecare Association's work, sort of in the month or so, coming up, or how providers can get involved. You mentioned about writing to MPs and things, but I just wondered if there's anything you wanted to signpost.
Yeah, I think being a member of an organisation like the Homecare Association gives us a collective voice. So when we go and speak to ministers or government, they often ask how many providers are in your membership, and the more you have, the more power you have. So we really are grateful to our members for contributing data for our surveys, because that also helps to give us media coverage, which in turn puts pressure on. So I think encouragement to speak up, to write letters, to take on your local authority if they're not doing things in the best possible way, and particularly also in a positive way to engage now with your integrated care systems, because that's where we need to make an impact as a sector. There's so many things, as I talked about earlier, that home care could contribute, could do, some of the things that Sharon was talking about, sort of the intervening time, but we could organise it so that there's more coordination with community health teams, for example. So I think, just make sure that you go and talk to the people in your local communities, you know, the health and the care professionals, and really go to your local newspapers with stories about the positive things that you're doing, because that also helps to raise public awareness too.
Yeah, no, I definitely think that helps, taking a story to a journalist rather than letting them decide either, as David mentioned, break the scary headlines, and try and bring that positive, because as Jay mentioned, so much positive, brilliant work going on in the sector.
I think it's worth saying how difficult that is, though, because I'm sat here as probably a bigger organisation. We've got the resources, and I think even we struggle to do that. So just a bit of a, you know, as a smaller provider, if you sat there thinking I should be doing all of this, it's really hard. Yeah, don't know what the answer is, but yeah, it's not easy, is it?
Brilliant. Yeah, no, and Sharon, definitely, I think we'll have to touch on the benefit system as well. And there's a much larger piece there to explore, because I think that'll be another, perhaps a future article or something that we can chat about, because that was all very, very interesting as well. But yeah, I'm conscious that I've taken up a lot of your time this morning. So I'd like to thank Sharon Lowrie from Be Caring, who's the Chief Executive there, Dr Jane Townson, and Jane's Chief Executive of the Homecare Association, and also David Glover from Caremark, the Chief Executive. So thank you so much for joining us today. I'm sure providers have got questions. I'm sure they can contact you or contact CMM, and we can feedback. Lots of different points covered today. Might have to tweak the title there on wellbeing, I think, because we went off into various areas. But yeah, it was brilliant to have your insights, and I'm sure there'll be lots more discussions on this. And obviously, we CMM will share the updates from the Homecare Association as and when you know, more news and reports and your obviously data, Jane, that comes out. So thank you so much.
Well, thank you. Thanks, Olivia. Thanks, David.
Thanks, Olivia.
Bye, Jane.
Bye. Bye.
Thank you for tuning in to CMM Off the Page. Explore CMM's portfolio of content, including daily news, blogs, a magazine, and CMM Insight webinars by visiting www.caremanagementmatters.co.uk. To make sure you don't miss a podcast, follow CMM on Twitter @CMM_magazine and use the hashtag CMM Off the Page to join the conversation and share your feedback. See you next time. CMM Off the Page. Listen, learn, lead.